Hi, welcome back to this educational video series on how you can incorporate yoga techniques within your hand therapy practice. My name is Bianca, the OT Yogi, and today we'll delve into yoga's breathing techniques, Pranayama, and mindful meditation, dhyana, for self-regulation and pain management tools. We'll also examine the literature supporting the use of these techniques within your hand therapy practice in order to be able to treat not only the physical, but the psychosocial needs of your clients with upper extremity injuries and disorders. So when working with individuals that have experienced a traumatic injury, such as a distal radius fracture due to a fall, it's common for them to go through emotional changes. Initially, they may be at a stage of denial. They may find it hard accepting their injury, especially when it starts to interfere with day-to-day activities such as opening a water bottle. Then they may be just constantly questioning themselves, could have I done something to prevent the fall? Could have I done something different? And these feelings aren't limited to traumatic injuries. Both traumatic and non-traumatic injuries can profoundly impact a person's life. It's important to note that sometimes this can also turn into psychological distress. Distress that can manifest in different ways, such as feelings of sadness, irritability, and a general dissatisfaction with life. Furthermore, if this psychological distress goes unnoticed, it can have physical consequences. It can disrupt the immune system, causing an increase of stress hormones, free radicals, therefore delaying the healing in the body. Therefore, it's very important within hand therapy treatment to take a notice of any feelings of sadness when they start to appear, or any notice of distress. This will allow therapists to be able to modify their treatment in order to treat the physical but also the psychosocial needs of those individuals that need an additional modification to their intervention. And this can be done by incorporating techniques such as pranayama, breathing techniques, and mindful meditation, dhyana, into your practice. So to begin, we'll talk about the breathing techniques, pranayama. So the breathing techniques in yoga, otherwise known as pranayama, are commonly known to enhance oxygen circulation in the body, potentially aiding in healing and promoting well-being. And within occupational therapy, practitioners oftentimes use diaphragmatic breathing, otherwise known as belly breathing, as part of their intervention in order to reduce stress, anxiety, facilitate relaxation, and improve lung function to enhance breathing efficiency. While there are similarities between pranayama and diaphragmatic breathing, they do have distinct characteristics. So pranayama encompasses various breathing techniques. Oftentimes they involve like rapid or forceful breath cycles, and they can also have slow and controlled patterns. The primary aim of pranayama is to regulate the flow of prana, the flow of life energy throughout the body, potentially harmonizing the nervous system and overall well-being. This practice involves deliberate breath control, incorporating specific rhythms, patterns, and retention techniques. So within hand therapy practice, patients can be instructed on these breathing techniques as a preliminary activity to help patients develop a deeper awareness of their bodies, to alleviate muscle tension before participating in therapeutic activities and exercises. And the primary aim is to help patients develop a heightened mindfulness of their breath to strengthen the mind-body connection. This can simply be achieved by instructing patients to practice deep breathing through the nose, exhaling through the mouth, and repeating the process 10 times. So by setting this time aside before starting with the therapeutic activities at the beginning of the session, encourages patients to remain attentive to their breath throughout the session, promoting activation of the parasympathetic system to calm down the nervous system, and therefore release any muscle tension that that patients are coming in with prior to therapy. So for those interested in learning a pranayama technique, I will now demonstrate a breathing technique called Kapalabhati breathing. So Kapalabhati breathing is a cleansing technique commonly practiced in yoga to warm up of the body for formal pranayama breath to movement practice. It involves rapid, forceful exhalations followed by passive inhalations. And this breathing technique offers an energizing breathing pattern that cleanses the body and mind. Kapala means skull, and Bhati means to shine. The two together means skull shining breath or frontal lobe cleansing. So here's the breakdown. First, instruct your patient to sit comfortably upright with either cross-legged on the floor or in a chair with feet flat on the ground. And then instruct your patients to relax shoulders and place hands on knees or thighs. Then instruct the patient to start to take focus to their natural breath. Taking a deep breath through their nose, filling their lungs completely, becoming aware of how the chest rises, the belly expands with each inhale, and how the chest lowers and belly contracts with each exhale. Then instruct the patient to then exhale forcefully and rapidly through the nose by contracting their abdominal muscles. This exhalation should be short and sharp, similar to a quick burst of air, focusing on expelling air forcefully from the lungs while keeping the inhalation passive. After each exhalation, instruct the patient to allow the inhalation to happen naturally without any effort. The inhalation should be gentle and automatic as the abdominal muscles relax. The rhythm to this breathing technique starts off with a slow pace, gradually increasing the speed of exhalations while maintaining the rhythm and intensity. 10 to 30 exhalations per round is recommended to get the full benefits of this breathing technique. So in a randomized control study done by Revue et al., examined the advantages of incorporating pranayama breathing exercises and yogic postures in enhancing cardiorespiratory function. The research involved 80 participants under 65 years old with stable coronary artery disease, divided into two groups of 40. Group 1 followed a 3-month daily yoga routine involving kapatahali breathing with very slow strokes for 3 minutes, dietary adjustments, holistic teaching, and conventional medicine, while Group 2 relied solely on conventional medicine. The findings revealed significant improvements in all pulmonary functional tests and cardiovascular parameters among CAD patients following a 3-month yoga regimen. Revue et al. Proposed that the observed enhancement could be linked to reduced sympathetic reactivity. This evidence indicates that combining deliberate breathing exercises with yoga postures that expand the chest walls might facilitate the dominance of the parasympathetic nervous system, potentially supporting healing across the spectrum of multiple medical conditions. Okay, so now we're going to move back on to the second part of this video on mindfulness, dhyana. So mindfulness is a mental practice focused on cultivating awareness and reframing experiences. It involves intentionally directing attention to the present moment and accepting thoughts, feelings, and bodily sensations. Regular mindfulness offers various mental and physical health benefits, including stress reduction, improved focus, emotional regulation, and heightened self-awareness. Chugh-Gupta N highlighted in a systematic review that yoga effectively reduced anxiety symptoms associated with various illnesses and conditions, promoting engagement in daily activities. Occupational therapists and CHTs who integrate mindfulness approaches may help patients become more aware of sensations like muscle tension, leading to a deeper comprehension of one's physical condition and an elevated level of body awareness that can transcend in everyday activities. In the same way, in a meta-analysis conducted by Costa et al. Revealed a positive association between mindfulness and reduced pain levels, along with improvements in mood and sensory body awareness for improved brain and body connection. These outcomes suggest mindfulness interventions enhance functionality among adults with diverse upper extremity conditions. Hatha yoga, which translates to the flow of sound, combines meditation and music to promote concentration and reduce the influence of distracting noises that can influence anxiety and tension in the body, while also aiding in optimizing breathing patterns. This practice encourages individuals to use their consciousness through music, fostering a union between the mind and the body. Hand therapists can effectively integrate Hatha yoga within their treatment despite potential time constraints. So let me tell you how. So for instance, if a patient comes with their own set of headphones, the therapist can suggest listening to a brief 2 to 5 minute meditation. This can be a guided meditation that can aid in pain management and relaxation. It can be done while the therapist administers passive range of motion exercises, retrograde massage, or therapeutic modalities like ultrasound. Before recommending this meditation and breath work, the therapist can educate the patient about the benefits and explaining how it helps regulate bodily sensations during moments of heightened tension, encouraging patients to become more aware of internal sensations such as muscle tension, and lays the groundwork for self-regulation. This preliminary step can assist patients in grounding themselves and alleviating any muscle tension to participate in therapeutic exercises and activities. So if you're interested in this method, I highly recommend checking out Erica Kluth, a holistic medicine practitioner who offers various short meditation options on her website. This short meditation helps create a relaxed atmosphere using visual imagery and breathing exercises to help facilitate relaxation in the body. As an alternative, if time permits and if a private room is available, this short meditation can be administered while the patient lies down in supine, enabling them to really engage deeply. That is all I have for today. Thank you for tuning in. The next video, I'll start to cover the modified yoga postures with the coordinated breathing techniques, and also explain how these yoga postures can serve as functional tools, aiding in the transition between therapy and everyday life. Stay tuned.